Hello, it's Dr. Farhanta here, joining you from Philadelphia, a city of brotherly love. My aim is to make your life a celebration every day. So let's get started. All the other things were done to make sure that they breathe better and their infection and fever gets better controlled. There's no FDA approved antiviral treatment for these patients. So as long as they continue to require the medical support, they were getting it. When these patients are at a stage that they do not get better, they were made comfort care because their lifespan has been shortened by this infection. And those are the elderly patients who actually are getting really affected. So if these patients arrive in the hospital and they have the high risk of developing the infection, they were put in isolation. Even in my own experience, there were cases where the COVID-19 test was negative, patient had all the other symptoms of COVID-19 infection. We repeated the test, and that test actually later on after 24 hours was positive. So it is important to keep those patients with high clinical suspicion into isolation. That means that I could not allow their loved ones to be in the room with them. And that's very difficult. As the patient condition deteriorates, their family wants to be with them, and they cannot be because they will get exposed to it. Unfortunately, I had to take care of one of the patient who was 89 years old from a nursing home, came in and had high fever and actually sepsis. She actually deteriorated over the next 24 to 48 hours, and only one family member was allowed to come and visit her. When we were informing them about her condition, they were all very concerned. I also informed them that all the people who have been actually in contact with that patient have to self-isolate. That puts an enormous amount of stress on people who have their loved ones dying in the hospital. Please take this information very seriously. Please wear mask. Wearing mask does not mean you don't participate in social distancing. You still need to wash your hands, you still need to wipe your surfaces and take care of your patients. Please make sure that people who do not need actual medical care don't go to the hospitals. There are times where unnecessary crowds are actually making the healthcare overwhelmed. Now that I'm going to talk to you a little bit about home care management. Many patients with known or suspected COVID-19 have mild disease. Majority of patients, they do not warrant a hospital level care. They don't have serious risk factors for infection. And I would also go over with you those risk factors in details. Having such patients who are not high risk should be treated at home, and you can get the help that you need through use of technology and talk to your doctors and be able to conduct those office visits via telemedicine. Another company that one of my colleagues have created is called COVID-MD, which is going to help patients get that care at the home. Indications for home management include when patients have mild symptoms such as fever, low-grade cough, myalgias without significant amount of respiratory distress, meaning shortness of breath, and basic techniques such as counting the respiratory rate, heart rate, check blood pressure at home, and oxygen levels would be very, very useful.